This morning, we're joined by Dr. Hannah Nagogwe Ayite, who's Senior Specialist, Radiation Clinical Oncologist, and Faculty Chairperson, Radiology, Oncology and Radiotherapy, Ghana College of Physicians and Surgeons, and President of the Breast Society of Ghana, Secretary General of the African Organization for Research and Training in Cancer, and member of the Ghana Medical Association. Dr. Richard Salome is Acting General Secretary of the Ghana Medical Association. And Dr. Hilda Mantibiabo is President, Pediatric Society of Ghana, and a member of the Ghana Medical Association. Good morning, and thank you very much for joining us.
Good morning. Thank you for having us.
I believe all of you are doing very well.
Very well. Thank you.
Great. So when I started talking about this, and I said we're going to have a conversation about cancers, the first question somebody asked me was, why is it really important to be talking about cancer? What is it, and why should he or she be concerned? Let me start off with you, Dr. Ayite. Yes, you can tell us.
Yes. Okay. Thank you very much. Yes. So cancers are known as the non-communicable diseases, and there are a variety of cancers. In fact, everyone, like you said before, can develop a cancer. It can develop in males and females, and it can develop in any part of the body. So that's why it's also very important. And over the years, the incidence of cancers have been increasing.
Okay.
Lifestyle changes. In fact, the older you grow, the chances of you developing cancer increases. Lifestyle changes, environmental issues, sometimes the food we eat, the viruses, the bacteria, the microorganisms that we come across, in our daily lives, infections, etc., can also result in cancers. And there are a number of cancers which happen just to changes that take place in the body, which you have no control over.
Okay.
So it's very important to emphasize screening as much as possible, early detection and all. So when you notice something strange in your body which has not probably been like that before, we all know ourselves, and usually you are the one who presents to the hospital, or someone may tell you that they have noticed something about you which you should follow up on. These are probably the ways of detecting that you may have a cancer.
Okay.
Thing is, cancer could usually present in a way that other diseases may present like, that some infections may present like, or it could present like a swelling somewhere, a sore area, soreness in your throat, things that could easily be another disease. So usually it takes a bit of time, if it's not very specific, for other doctors to be able to rule out other possible reasons before they come to the likelihood of a cancer diagnosis, and then start investigations. So in brief.
And let me just find out. So you've talked about it, but for that person listening to us, he's asking himself also, how does it develop and why should I be concerned? What harm does it pose to me?
Okay, so if we are going to how does it develop, then we are going into the genesis of cancers. Yes. So the body is made up of, the smallest part of the body is what we call the cell. And the cell can function on its own. A number of cells come together to form tissues, and then tissues to form organs, the organ system, then the whole body. So you see, the cell is the very smallest part, and that cell undergoes changes from time to time, divides, break down, and then divides into other parts, then eventually breaks down, dies, and new ones form, etc. But there are times that this division goes wrong. Something happens due to either some changes in the person's, what we call the DNA, the genetic material, or due to other factors I've mentioned before. When that happens, it becomes, it's like an unruly, I always use the term, like you have children looking after, being trained to go in a particular way, and there's one child that becomes unruly and just decides to go its own way, doesn't respond to anything, it's so difficult to control. That is just in essence how a cancer behaves. So then it starts growing abnormally, and when it happens like that, it tries to survive wherever it is. So it is trying to get all the oxygen, all the blood supply, everything, to make sure it is master where it is, spreading where else it can go. It develops certain characteristics or certain features which makes it able to spread to other parts of the body and stay there and develop and then cause changes. It makes its presence felt wherever it goes. So that is in essence what cancers do. And because of the fact that they can spread, they go to other parts. For instance, if it starts in your eye, or it starts in your lung, or it starts based in your throat, it can go into your brain. Some people may land at the psychiatric hospital because they are behaving abnormally, and people assume that they have a psychiatric illness or a mental illness, simply put. But in actual fact, it's probably because there's a cancer somewhere which has spread to the brain and is making that part of the brain which determines how you function and how you behave and all. It's making you behave abnormally. That is just one example. It could also be spread to the lungs. The lungs is supposed to be where there's air exchange. So you breathe in, breathe out, and you are feeling okay. It gets to a point where the cancer invades the tissues of the lung. What happens means that now you have very little space for that air exchange to take place. And then you start having difficulty breathing. Or around the lung, there's something called the pleural covering. It's a covering around the lung. Let's say it's something put in a rubber bag. In that bag, around it, there's usually a little bit of fluid, which is normal to allow the lung to sort of move in and out, sliding very well. But sometimes the cancer causes a lot of fluid, like liquid water, but not exactly water, but some fluid, to fill up the space. So if air is going to go through water, it's as if you are drowning. And you don't really have that air exchange. You are in water. It just feels like you are in water and you are drowning. So you can't really breathe in and out. That can also kill you. Cancer can also spread to your bones. And when it happens like that, it makes the bones very soft and brittle. It can also cause the brittle bones to break. Fractures can happen. And then you can end up in such a situation where suddenly you are walking, suddenly you fall, you have a fracture, no car hit you, you didn't fall down from a staircase, but you suddenly cannot walk. We've had patients who are just taking off their shirts in the morning, and all of a sudden they have a break, their clavicle just breaks, the collarbone just suddenly breaks off.
Just like that.
Just like that. So you see, these are some of the things cancers can do. It can spread to your liver. The liver is the greatest organ where all the detoxification, you take medicines, you take all sorts of harmful things, etc., are broken down to make them neutral in the body. Cancers can invade that place and then cause trouble. So you see, because of what can happen with them, it's usually best that it's detected early. Unfortunately, not all cancers can be detected early. Some of them happen insidiously, slowly, and by the time they are detected, they have already gone very far.
But we're talking about early detection, but not all can be detected early.
That is just to tell you there's the other side of it. But most of them can be detected early enough. So if you notice, for instance, if you're talking about the breast, if you notice marked difference in the size of your breast. Marked. I'm saying that because naturally one breast is larger than the other one. So it's not as if, because if you are not careful when you are talking, you're not careful what you say, immediately you cause alarm, false alarm. Exactly. So marked difference in the size of the breast. Or you notice changes on the skin. The skin becomes like an orange peel. That breast, it feels like an orange with little bumps around it. Or you notice some tethering or some changes in the color of the skin. Or you notice a swelling, a mass, something. You can feel that there's a lump in the breast which has not been there. Mind you, there are lumps in the breast which are not cancerous lumps. So you see, that is why you need to go to the doctor. You may start, if you are not at a facility where there's a doctor, you could actually go to meet the nurse who is in charge of the place, or the medical assistant. They'll do preliminary examinations, and then that's why we have primary, tertiary, secondary, tertiary. So then you move on. They move you on to the next facility where you have someone who is experienced enough to be able to feel it and say, I think we should do so and so test to find out what is happening. You may need to do an x-ray, you may need to do scan, and then they may need to take a little bit of that lump, whatever it is, what's called a biopsy. The doctor takes a little bit, and then another doctor looks under it and under the microscope to tell whether, okay, this is not something to worry about. It's a normal type of swelling. We can just go and remove it. Then the surgeon will remove it. But if they find out that, no, it is a cancerous type, which is not the normal swelling, then you may have to go through the processes. Either you have it removed surgically, where they do an operation for you, for everyone to understand, and you may also have to take some medications that are anti-cancer to help reduce the chances. So this is just looking at the breast. If we are to move on briefly to look at, for instance, cancer of the cervix, which is the second commonest female cancer in Ghana now, what you may notice is that you are probably having, you should be having normal periods. So we talk about those who are non-menopausal and those who are menopausal. So if you are not yet menopausal, you will be having your normal periods. What you notice is you may start having bleeding at times which are not your regular periods. So you may be bleeding throughout the month, which should not happen. You should have a period, maybe a week, and then after that but you may be bleeding frequently. The other thing is that you will be having foul discharge or smell, or foul vaginal discharge, odor coming out from your vagina. In that case, you should also go to your doctor. It could just be an ordinary infection, but it could also be cancer. You may also be realizing that whenever you are having sexual intercourse, you have severe pain. That's one of the presentations. And then you also go to your doctor for review. They will do an examination. The gynecologist will do an examination. If there's something there which they find, they will also take a little bit, which is called a biopsy, to the lab for further investigations. If you are male, prostate cancer is one of the commonest. We have liver cancers, etc. But if you look at the other cancers, prostate is also, for my facility, for instance, the commonest male cancer. So in that case, you may also have had, and usually it's more in the older men, but we still have some people, even 50s, above 60s, who still develop prostate cancer. It could be from strong family history of prostate cancer or other. So it's important to be checking. You may also notice that probably you are you are having problems with urination, either painful urination, frequent urination, or when you get to the toilet to pass urine, you have significant difficulty even starting off the urine, or you are dribbling after that. There could be a problem with your prostate, or you are having difficulty just passing urine. You notice that it's like there's some obstruction. You have to strain several times. Or at night, you are sleeping and you tend to get up several times in the night. So you can really not have meaningful sleep. You wake up in the morning very tired because you have visited the toilet so many times. And then you have incidences where sometimes you have men, in code they say shamoba. You can't pass urine. All of a sudden, you are rushed to the hospital. They have to pass a catheter. It's not always prostate cancer. There are times when there's enlargement of the prostate gland. We call it benign prostate hyperplasia. That could also cause that. But you could also probably have a cancer which could be investigated. So these are some of the common cancers. There are a lot of other cancers of the head and neck areas, which are also cancers on their own, where you can have cancers of your eye, you can have of the facial features of the jaw. You can also have cancers in the throat, of the voice, the larynx, the voice box, and others.
Okay.
And then you can also have cancers of the gastrointestinal system. When I say that, I mean from the mouth. There's a long tube that gets into the stomach. It's called the esophagus. And then you have the stomach. And then you have the intestines. Everybody knows intestines.
Sure.
For medical terms, we have the small intestines, we have the large intestines. And then you have the anus, where cancers can happen in any of these structures along that time till it comes out. In fact, the exit point, the anus, you have cancers also happening there.
Wow.
Yes.
We'll continue with the conversation. I'd love to hear from Dr. Richard Salome. I'll hear from you, Dr. Hilda Mantibia-Boy, who is president of the Pediatric Society of Ghana and a member of the Ghana Medical Association. Because I want us to talk about, the young ones also, the children. I mean, the cancers that affect them. I'll get to you, Dr. Richard Salome, who is acting General Secretary of the Ghana Medical Association, to tell us, what to look out for, some of the things we can do to prevent these cancers. And then we'll look at, whether it's curable or not. Dr. Hannah Nagogwe Ayite will be telling us more about that. So this morning we're having a conversation about cancers. Let me get to you, Dr. Hilda Mantibia-Boy. So let's look at our children, okay? I mean, ordinarily, for many people, when you talk to them, when they hear cancers, nobody really thinks that children could also have cancers. Tell us the childhood cancers that we have, particularly in Ghana.
All right. So the children can get cancer, and we have a number of children presenting to our facilities with cancer. In the Korle Bu Teaching Hospital, we have about 240 new cases of children who are diagnosed with cancer every year. We have other facilities, Komfo Anokye, Tamale Teaching Hospital, and others in Ghana that will make the diagnosis, start some treatment at certain points, and refer to us. The commonest ones that we are seeing now are the leukemias. So the leukemia, which is a blood cancer, and then we have the lymphomas. The lymphomas are cancers of the lymph nodes. So you see, typically you see swellings, big swellings. You could see a jaw swelling. You could see big lymph nodes around the necks swelling. So these are typically the lymphomas. Then we have cancers of the kidney. So we call them Wilms tumor or nephroblastoma.
Even at that very young age?
Yes, even at that very young age, we have all those cancers. And then we have the retinoblastomas. That is the cancer of the eye. So the retinoblastoma. So you have those as well. There are others, bone cancers, nasopharyngeal cancers. So
hold on. When you say this, you bring them down. So those of us who are not, medical practitioners, so we can understand.
All right. Okay. So I think that basically, just like Dr. Gogwe said, the cancers can affect every part of the body, from the blood through to the bone, through to the skin. Every part of the body can be affected, and children are no exception. They also develop these cancers. The commonest that we are seeing now are the blood cancers, and then you have some of the others that I mentioned. And in children, just like the adults, they may have a fever, or their temperature may go up. And this is fever that is typically persistent. So if I say persistent, today you have a fever, let's say this week you've had a fever, your temperature is high, then next week it's as if it's down, the following week it's gone back up, you've been to hospital, maybe initially they said it was malaria, then the following time somebody is still saying it's malaria, or now they are not sure, it persists. So that is fever. And then they may have bone pain, so they may complain about pain in the joint, bone, my leg is paining me, my arm is paining me. So all those may point us in the direction of a cancer. Weight loss is another very important symptom. So if you have a child who is otherwise eating well and is still losing weight, is unwell most of the time, these should prompt you that the child may be having a cancer. Then the abnormal swellings, or the swellings of the body parts. So I mentioned initially you could have swelling of the jaw, swelling around the neck, swelling of organs in the abdomen. So you could have the child's tummy become very big and you are not sure what it is. It could well be a cancer. They may also have anemia where their blood level would go down, and that would make them easily tired. And a number of these symptoms I have mentioned may also be present in other conditions, but once it becomes something persistent, the child is losing weight, you're not really sure what is going on, it's very important that you see your doctor very early. And if it's at a lower center or a lower facility, they may have to refer to a higher center where the tests that are required for the diagnosis to be made can be done, and the child can be appropriately diagnosed and treatment initiated. Because if they come in early, the chances of survival or cure go really high compared to if they show up very late. If you show up at the time where the organs are all damaged, so where the initial problem was, it has gone beyond that place and gone to involve other organs, this means that you have come in rather late and your chances of surviving or having a cure go low. So that means that probably if you show up that late, then all we may be doing for you is keeping you comfortable until you eventually die. So death is the major thing in cancer. If you do nothing about a cancer, you will die. And different cancers behave in different ways. So there are some that will kill you in a very short time, and there are some that will kill you, it will take a bit longer, but you will not survive if you do not receive the appropriate treatment early. So we want to avoid death in children with cancer, and we know that if they present early or they show up in hospital early for the diagnosis to be made and the treatment to be initiated, they do very well. We have people who are adults now who are working, who have families, who are living the life that we are all living, but they had cancers as children and had treatment early and were cured. So it's not all gloom. There's a lot of hope. It's just that parents, caregivers have to be able to identify these symptoms and show up to hospital or the right places very early to be diagnosed and for treatment to be initiated.
Great. Let me get to you, Dr. Richard Salome, because yes, we've learned that, cancers are, the abnormal growth of cells and everything, and what they could do to us. But what causes these abnormal growth? I'm just interested in it. Before we get to the prevention, what causes them?
Okay. So I think Dr. Ayete talked a little bit about that. The truth is, it's difficult to say. In some instances, we know, because some of them we know are linked to specific viruses, for example. So we know some of these viruses insert themselves in how the DNA works and then begin to cause the DNA, should I say, to work in ways that causes your cells to grow haphazardly. So for example, we know that patients who have had hepatitis infections, hepatitis B especially, tend to develop liver cancers later on. So if it's found early, normally you'll be given certain medications to try to slow it down, but we know eventually a number of them will develop liver cancers. We also know, for example, human papilloma viruses in females tend to contribute greatly to cervical cancers, and even some head and neck tumors. I'm a maxillofacial surgeon. But for majority of the cancers, we cannot pinpoint. You see, in science, we talk of causation. What it means is when A is present, B must happen.
Sure.
And that is why often we talk about risk factors. What this means is that when a lot of these are there, you are likely to develop that. So the actual cause that would tell the cell to immediately start growing out of bounds, start destroying tissues around, start spreading to other places, is difficult to say in most cancers. However, we know that when certain conditions are present, it is likely that your cells will misbehave.
What are these conditions?
So we know, for example, that when you smoke, the chances of you developing cancers, especially of the respiratory system and even other parts of the body, is way higher than the regular population that don't smoke.
Okay.
Alcohol intake. We also know that chronic irritations, for example, those of you who wear dentures, you wear a denture, it's not fitting well, it is irritating, there's a sore there that it keeps irritating for long. Chances are that the body is trying to respond. That response may go out of bounds, and then you tend to have that. We also know when you have certain infections, like I have mentioned, like some viral infections, you might be able to develop it. We know also that those exposed to should I say, high amounts of some radiations. So people, seafarers, for example, tend to develop some cancers. And then we know that we are protected very well by the melanin that God gave us. If there's something wrong with that, like people who are albinos, for example, that protection is not there as much. And therefore, your radiation can begin to cause problems for you. And then skin cancers tend to develop in these people. So those are some of the risk factors we talk about. But of course, as you said, if you grow old enough, long enough, the chances are much higher for you
And
to develop.
old enough is what? When you grow old,
There's
old
no
enough.
figure to it because,
okay.
as I said, it can develop at any point. But what we are saying is that your cells work in a very well complicated but very well coordinated fashion, where your cells grow. This skin you see here today, it's not the skin you are seeing in about 2 weeks. The cells are dying off. That's why you wash it off. And then new cells are coming in. They know their role and they stop there. But there can be an aberration at any time so that the skin can start just going off and misbehaving. So what we know is that generally as a machine grows, your car is growing. 20 years time, you start visiting the filter more often than when you bought it fresh. Good. Similarly, your cells tend to have problems with how they control and coordinate these functions as you grow. And that is why there tends to be more problems like control of the cells, which can lead to cancers and other things. So the longer you stay on life, the more the risk. It doesn't mean you will develop, but the risk is higher in that sense. I just want to add a bit about why we must be worried or
Sure.
care about cancers.
Go ahead.
I think they spoke about a lot of the issues, but then we should also know that between the disease and death, cancer causes a lot of damage and then can lead to a lot of disability and affect your quality of life. I work in the head and neck region, so people who develop tongue cancers, you realize that their speech is affected. They can't taste anything that they are eating. Sometimes it grows so big, fills their mouth, they can't close their mouth, they are drooling all the time. Imagine being a worker, for example, who is a front office staff at a bank. You can't be at the front office anymore.
Sure.
It affects food you can even eat, because now you can't chew, your teeth are in a disarray, so you can't chew. So it is important we catch it early because, one, it is cheaper to treat when you catch it early. And then also the disabilities are reduced. Your chances of a cure are higher if you catch it early. The other bit why we must worry is that, as they've said, many of them, for some people, it's just fever. For some people, it's just fever. I know on your show you covered my grandson, Michael Isiama, if you heard of that issue. His own was changing vision because it was a brain tumor. And he kept complaining about his sight. And you think it's this. The glasses changed several times. And then he began having vomiting episodes and seizures. Then it was referred to a higher center. And it turned out to be a brain tumor. Unfortunately, we lost him. So the thing about that is that you don't know when it will happen. It may be happening quietly and you don't even know. And that is why, not that we should worry and be rushing to the hospital per se, but you should be checking yourself regularly to notice your normal, and when there are any changes, then you seek care. So these are some of the reasons we must worry about it. The cost to you, the disabilities that it causes, the quality of life changes that it can cause, and also the bit about stigma, and then the psychological, emotional, and financial trauma that it causes to a lot of families. So it is something we should all be worried about. And for us at GMA, we have noticed, as you said it, more and more people presenting at facilities with cancers these days. And not just more and more people. At first, we thought cancers were for the old people. But we are noticing that young people in their productive lives are now turning up with cancers, especially with hepatitis B and the lifestyle issues, which, because it leads to liver cancers commonly, a lot of people, And people do not even know that they have hepatitis until it's late. They are presenting. It is only when they have a hepatocellular carcinoma that they come to the hospital, then it's detected, or they have a severe jaundice, then they find out that they actually have this, and they are finding out. So it's something that we think we need to seriously be discussing and checking ourselves for.
Great. This morning we're joined by Dr. Hannah Nagogwe Ayite, who is a senior specialist radiation and clinical oncologist, faculty chairperson, radiology and oncology, and radiotherapy at the Ghana College of Physicians and Surgeons, and president of the Breast Society of Ghana, and secretary general of the African Organization for Research and Training in Cancer. Dr. Richard Salome is acting general secretary of the Ghana Medical Association, and Dr. Hilda Mantibia-Boy is president of the Pediatric Society of Ghana. We're having a conversation about cancer. So you've talked about causes or risk factors. We've talked about how do we prevent it?
Good. So, as we've said, prevention is then targeted at things you should do to minimize, as we've said, because you're a human being, just like any machine. As you grow, there's going to be a point where things will not work. You have to go to the fitter. You have to get things done.
Sure.
So you look at things that you do to reduce your chances of having problems. Now, these are targeted usually at the risk factors. Those that we know specific causes, then you can target the causes. So majority of the things, as we've talked about, go towards lifestyle. So smoking, as we said, is one of the major causes. So we need to target that. It means you would need to look at cutting down on smoking. Of course, we know people who smoke, there's an addictive component to it. So trying to stop all of a sudden can have a rebound effect where you then have to get back to it quickly because you just want it so bad. So we normally encourage you to. There are various programs that are specific towards smoking cessation, but you can gradually cut. If it's 20 sticks, you can begin to work your way down. Say every month you are just taking one stick off your usual. We know alcohol is also one of the common ones. We also know the other risk factors which are infectious, as I have mentioned, like the hepatitis, like the papillomavirus infection as well. Most of these, we know one of the commonest routes to get it is having unprotected sex, and then multiple sexual partners. So what it means is you would want to take a look at that, reduce the unprotected sex and multiple sexual partners. Also, other means of getting these infections, like people who use injection drugs, who do hard drugs and inject themselves all over. Of course, we also know that generally exercise improves almost everything in our body.
Okay.
Helps our body to do various things. These things are all in our control as people. Now, the other preventive bit is what will help you when you have the knowledge. And the person to do that is in the health facility. So, other bit is to what? Get yourself checked on a regular basis, visiting the facility to just check so that if there's something is seen early. And then also, your diet is a big player in our body, how it functions, how the cells are controlled. So our diet, and of course we know these days the fast foods are predominating, and we know that various conditions also contribute, like obesity and others tend to also contribute to some cancers or risk factors for some cancers. So we would have to all look at our diet, exercise regimen, and then there are specific ones which may be medical in nature in terms of prevention. We know there are also medications that also help the liver to fight or prevent some of these. For example, people with hepatitis are given some medications that help their liver to be a bit more quote and unquote stable and not the cells go haywire and begin to form cancers or reduce the chances. So there are the non-medical ones, then there are some medical ones, and then the general bit of lifestyle changes that we will have to do. Of course, the specific cancers will mean that you have specific things that are tailored, but we are talking general, and that is what's, yeah.
How about the children? I mean, I'm very curious because for many of them, they probably may not know even what they are going through. So it's something that the parents must do for them. how do you prevent your children from getting these cancers?
There are quite a number of them that you cannot do anything about. So it's not always going to be preventable. But the infections that he talked about, if some of those prevention measures could be put in place, because if you even look at, yes, so the vaccination and all, very helpful. Then avoidance of the contact with insecticides, because some insecticides, the pesticides, have been linked with cancers, malaria prevention as well.
No, hold on, no.
Yes.
Insecticide.
Yes, the insecticides, those chemicals, pesticides, all those chemicals.
But how do we know?
Because there have been studies that have linked them to the development of certain cancers. So,
But so these insecticides, studies have linked some of them
yes.
to the development of cancers.
Yes.
Then we should not be selling them.
So you see, everything, even medications, even medications have side effects. And medications that are supposed to treat you for certain conditions can become a poison if you are taking them in excess or you're going over the dose. So moderation in everything and avoiding where possible. That's what I'd say.
You see, Dr. Mantibia,
Yes.
I am a journalist.
Yes.
And I like to study accounting. A lot of my readings will be in journalism, finance, and and politics. So I wouldn't know these things. And so if you expect me, and so if I am going to buy an insecticide, for instance, I wouldn't know which one has chemicals that are likely to, expose you to this or that. So, I mean, speaking on behalf of people who are like me, then the issue should be, why are these things in the market?
Okay, so what I would say is that, you see, even, let's say, if you talk about the mosquito spray, I'm just using that as an example. There are safety precautions there when you're using them. You don't spray and sleep inside immediately after. You have to wait for it to work for a while, good ventilation before you go in, handling of pesticides and all. So for all these things, when you practice or observe the safety precautions, then the chances of your exposure to cause you to have some of these cancers will go down. So it's not really about a particular brand per se, but they are generally safe, and that is why they are on the market, because they have gone through approval or Food and Drugs Authority. So it's important that we observe those precautions.
Okay.
And just to add to that, you see, that's why there are labels. So you realize that cigarettes, actually, as it's a classic example, it is written boldly on it now and required by a law that smoking might lead to all the problems. Some even have a drawing with body parts showing cancers. But of course, people still smoke. So for pesticides, if you realize some of the cans have instructions on how to use them, and then also how to properly adorn yourself. But you realize that sometimes we don't wear the protective wear. They come in contact with the skin, and then on top of that, there's also radiation from the sun, and all these mixed together risk you over time to develop some cancers that out of this. So it's important that we obey the precautions, because it may be safe used in an open environment, but it's not safe using a pesticide in a closed environment. And then you must wear the protective gear and all that.
Yes, Dr. Aite.
Yes, I just want to add something to that as well. Apart from that, preservation of our food items. Unfortunately, mothers and fathers in the market have also, and sometimes the farmers and all, sometimes spray the food items with these pesticides and chemicals, and just to try and get rid of cockroaches and rats and all sorts of things. And sometimes even the food coloration that is used to color the food to make it more attractive. I actually had a chat with a woman in the market recently. She said, "Doc, if I don't do this, they will buy the other woman's product and leave mine because hers are more attractive." So I think we should also look at that. I know FDA is also looking into things like that, but just to let us know that it can come closer to you than you think.
In fact, it's closer to us than we think.
Oh, yes.
Exactly.
Because really, I mean, you don't know what you're buying from the market.
Exactly.
And even if you're buying food outside already prepared, you don't know
What was used to cook
what
it.
was used to cook it. So it becomes a problem. Is there another thing you want to add? Because I have seen my friends who smoke sending messages that they've heard. Those who
yes,
drink alcohol,
yes, they
are
know
sending, they are sending
exactly.
messages.
So alcohol and smoking. Richard mentioned that. In fact, they are one of the top causes of lot of cancers. If you put so many cancers together, smoking is even one of the causes of a cervical cancer. I mean, in Ghana, we don't have a significant smoking problem
No,
here.
but Doc, these
Looking
days,
at other,
the younger ladies are doing shisha. Which
you
we
know, that's true.
Which we
That's
know
true.
it's more than actually taking just one stick and smoking.
One stick, that's true.
Shisha.
Throw more light on that.
Oh
one.
yes. So you see, there's this thought that shisha is not harmful because it goes through water and is that. And there's studies to show that is the same as the smoke you are smoking. Unfortunately, we do this because it's recreational. I'm not going to go and smoke shisha alone. I'll go with Hilda.
I'll go with you.
You won't go with me.
Yeah,
So
yeah.
we tend to go with friends. Now, often the friends think that they are not doing the smoking, and so they are fine. We have what we call secondary smoke. The smoker tends to even be a little bit more protected because the body tries to adapt for a while before the changes happen. Because the body will change the cells to try to adapt to prevent changes happening in that person. You, the secondary person, the friend who doesn't smoke and is sitting by, and the person smokes and puffs on you. Because your body has not adapted to any smoking, you are even at a higher risk when you are receiving a big dose at the same time.
So in effect, we shouldn't sit close to them.
Of course.
When they
Or
want to-
advise them to cut it down. So shisha, please, is something that we really need to look at because it's becoming something like a status symbol. A lot of younger people are doing it. Now, what I just want to say is that the thing about disease is that we think it should happen immediately. It's like falling over a cliff. You may be flapping for a long time before you actually fall over. The disease, especially cancers, tend to build over time. The body tries to even take care of some of them over time. It's up to a certain threshold, then you begin to develop it properly. So you might think you are young, I can't get cancer, I can smoke for another 20 years, and then I will stop when I'm 40 and I should be fine because they said it's old people. No. You could smoke, damage the cells now, and what it means is that by the time you are 40, then you are dealing with a big issue on your hand.
You know what we're going to do right now?
Yeah.
We're going to go for a short break.
Right.
When we return, we'll activate the phone lines. We'll also talk about the lecture that you have on cancers.
Great.
That's a very important thing also.
Yes.
Because I see a lot of people sending messages. Please, I'm going to activate the phone lines. Try. Reach us and ask your questions. In case your questions don't come through, I'd ask your questions for you. But this is the Super Morning Show on Joy 99.7 FM. And this morning we're having a conversation about cancers. It's a general conversation. I'm sure later on we'll pick them one by one and, talk about them. Selina is in Accra. Good morning, Selina.
Hello, good morning.
Yes, Selina.
Please, I've been listening to the program,
Okay.
and I'm happy with whatever they are discussing. My issue is, if they know the health sector, they know the problem that is causing the cancer. From their discussion, they are saying they know some of the issues that brings about those ones. And I think they have control over the market than us. If people are selling in conditions that are not helping us, if farmers are applying chemicals that are not good to our conditions, why are they not contacting those institutions so that they do the right thing for us? Rather, they come to speak on the radio, and I don't have any control over that. They should please help us.
Thank you.
Thank you
very, very much, Selina. They will definitely help you. Would I get answers to this question for you? Emmanuel is calling us from Kolebu. Emmanuel, good morning.
Hello, Wisdom. Good morning.
Yes, Emmanuel.
And my regards to Dr. Mantibia and then the panel.
Okay.
Yes, I want to know about consuming of the alcohol. What are the symptoms which culminates to this
What are what?
disease. The consumption of alcohol,
Mm-hmm.
excessive consumption of alcohol. What are the symptoms in terms of cancer?
Okay. All right. Thank you very much for joining us. Let's go to Kumasi, where Nana is. Nana, good morning.
Hello, good morning.
Yes, Nana.
I had an experience with my child. He had a swollen lymph nodes together with a swollen jaw. But then he had catarrh then. And then we sent him to the hospital and they give him antibiotics and painkillers. And then he has come down. Should I be worried? Is it some of the symptoms that I should be worried and I have to send him to a higher facility for a checkup?
Okay. Nana, we'll get answers to that question for you, okay? Okay. Thank you very much, Nana from Kumasi. Samuel is in the Volta region. Samuel, good morning.
Yes, sir, good morning.
Yes, Samuel.
Yeah, thanks to our colleagues there. You see, it's about time we tell our people the blank truth. Look, we are learning over 200 children, new children are being diagnosed every year now in Ghana.
At Kolebu?
At Kolebu,
Yes.
just in Kolebu.
Yes.
Yeah. Look, what is accounting for this? What are the risk factors? Childhood nutrition today is a problem. We are feeding our children with hazardous foods, and we must take care of that. Let's speak the truth. So many things on the market today we are consuming are increasing our risk. And this is what we should start educating our people on. Please, it's getting out of hand. Thank you.
Thank you very, very much for joining us. Samuel, Yuseli from Western North. I hope I got the name right. Good morning.
Good morning.
Yes, please.
Please, the symptoms that will show for you to, so someone having hepatitis B,
Mm-hmm.
then he took medication, then later on some symptoms. Will it affect one side of your rib? Because sometimes you feel some pains at your left side of your rib. Is it a symptom?
Okay. Thank you very much, Yuseli, who will be our last caller for now. We'll get, our doctors, Dr. Richard Salome, Dr. Mantibia Boy, and Dr. Aite to address these questions. Yuseli says he's asking a question about symptoms when you have hepatitis B and you take medications. You have pains at the left side. He's asking whether that's really the case. You are the experts in the field. Yes, over to you. Any of you can answer these questions. Yes, any of the questions.
So I think I'll take the first question. Selena, thanks for your question. I wish we were empowered enough to have the powers that you wish on us to arrest some of these people who spray their foods with insecticides, those who bring some of these hazardous things to the market, bring certain medications and other things that risk people to get cancers. Unfortunately, as health professionals, people tend to see us to have certain powers. Like, why are you not even when there's no oxygen, somebody thinks you must be the one to provide it, even though that's not your job. There are bodies mandated to do these jobs. Part of what we are doing here today is our role, where we educate the public to know. The larger power lies with you, the people. Ask questions of that woman who is selling you that fish, which you can smell something like a mosquito spray on. And stop buying from that woman. The market responds to such things. You will see that she will have to change. Don't also begin to follow, the meat looks redder than normal. And you don't know what dye has been applied. And sometimes you can see it clearly that it's dye, it's not blood. I mean, the fluid that comes, the one they cut at the market, small. You see it that is being colored with this very red dye. And you should ask questions and not buy that. Get to the abattoir and buy. If we, the people, use our purchasing power well, you realize that some of these things, they will not bring it, because if he brings a container full of that and you don't buy it, he's making a loss and he won't bring it next time. There are bodies that are mandated. FDA is one of them. They try to do their best, but we need to keep calling them, and we the people also, when we see these things, after we have educated you, you should quickly call FDA, who are reachable. And I've seen a few times where people report and they've taken action to deal with some of these people. So we'll do our best to educate you, but then there are bodies that are mandated to do some of these things. Thank you.
Okay, and then Emmanuel was talking about the consumption of alcohol. What could be the symptoms?
Okay, so I just wanted to say that I know whenever we talk about alcohol in relation to cancer, there's usually a lot of uproar. A lot of people ask questions. This happens wherever I go and talk about cancer and mention alcohol as one of the risk factors. So, like we said, a little bit of alcohol. There are normal levels of, I can't talk about that now, that acceptable alcohol limits for men and women and all. But excessive alcohol consumption, like he said, causes so many other problems. But in cancers, it can, especially cancers of the head and neck region, like Richard mentioned, cancers from the mouth, what we call the oral cavity, the mouth, the tongue, the lining inside the mouth, the back of the throat,
the bone
the jaw bone itself, the throat, even the what you use to speak, your larynx, the voice box, the esophagus, that is the long tube from the mouth to the stomach, that is also affected by that. Even the stomach, the other parts of the body. And then I mentioned, even for other cancers, you won't think alcohol could have an effect on breast cancer, cervical cancer, other cancers. Virtually any type of cancer can be affected by alcohol and smoking. These two kind of run together. So it's absolutely important to limit alcohol intake, apart from the fact that you could have mental problems, you become addicted to it and you cannot really control yourself. So I think we, as much as possible, we need to realize that it is one of the causes of these cancers. And we have people who come in. When they come in, you take the history, you realize that they have been taking alcohol or smoking for years. And this, you can tell, was obviously the cause of their cancers. Apart from the infections that happen, we have several viruses that are related to these head and neck cancers. And the rest of the body. Some particular type of food items have also been related to particular cancers. But this is, in a nutshell, what I have to say on alcohol.
Great. And so Dr. Mantibia, Nana was talking about the child having swollen lymph nodes and also had catarrh at the time, and she's asking whether she should be concerned.
With the upper respiratory tract infections like the colds, the tonsil infection, ear infection, you could get the lymph nodes being enlarged a little bit, not too much, maybe about 1 centimeter. You could feel it under the jaw or under the chin, yes, and it's usually, it could be maybe a little bit painful or maybe not even painful, but not much bigger than that. So these are expected. And if it's a bacterial infection, for example, and the child is given antibiotics, it will go down. But if you have these swellings under and they are getting bigger and bigger and bigger, even to the point where they are disfiguring the child or having other symptoms, some of the other symptoms like the fever persistent that I mentioned, then you should be worried. But if it goes down right after the antibiotics, child is otherwise well, no other issues, then you are fine. But let me just say this also, that if at any point you are concerned about your child, see your doctor and speak with your doctor, because your doctor has the benefit of being able to actually thoroughly examine the child, assess the child well, to give you an informed opinion about whether they think your child is unwell and requires further testing or is just fine. There was another comment about what's accounting for these cancers. I think we've gone to town with them, so I'll leave it at that if that's okay.
Because the concern was about childhood nutrition.
Childhood nutrition. So it's not really like such a big thing, but like we have said, if you're eating food that is contaminated and all that with the chemicals, then the risk could go up. Generally, avoiding some of these infections that we talked about, taking care of your child, the child is generally fine. So don't worry too much about the nutrition. By all means, be careful and be sure of what your child is taking, that is nutritious, that is a balanced meal. We don't always have control. And a lot of these cancers could be hereditary. You could also not know what the cause is for these children. So it's a bit difficult, but just know what your child is taking in, avoid the infections, and just take care of your child.
Yes. If I like to just add something to what Hilda is saying about the balanced diets of children, I mean, it's very important for everyone, including the children. So having some amount of protein, not too much carbohydrates. Usually, because of the economic situations, we tend to, if it's a banku, a big ball of banku and very little fish, you can barely count the number. But protein is important for the children. Vegetables as well. So you need to also have vegetables in your food. And in the children's, usually children run away from having vegetables, but that's very important. Fruits. You see, so if they have fruits, they have vegetables, because these have vitamins and inbuilt ingredients which help us fight, and the antioxidants, exactly, which help us fight the diseases. So if the child has a lot of these, it's important. Some studies done recently shown that obesity in children is becoming a problem because they're eating a lot of junk food, a lot of the wrong types of foods. So, and we know that obesity is also one of the risk factors for cancers. So just to come in there to balance.
Let me
it out.
just add quickly, once you've added that, these days we don't allow our children to do physical activities.
Yes,
So
exactly.
the children essentially are head down on tablets and on phones and on PCs. Let the children play. Let the children be children. And that is very important. Lack of activity and exercise among children is a big issue. This is just a general thing, even though it contributes to childhood obesity, which is a risk factor. And so we should get our children to play. Let them run. Let them do stuff that keep them active and get them going as well, not just hooked onto the tablets. And as she said, don't give Daddy Winston all the meat and give the children the smaller bit. I know Winston will come back at me.
No. I mean, on the contrary, I am not really much of a meat person. So that one you can get the children to eat the meat. I like the fish. That one is for me. Anyway, but Yuseli was asking. He says, he takes medication for hepatitis and he gets pains on the left side, left ribs or so, he says, and whether that's normal.
Well, I would just advise usually that the best is to get to the hospital. Actually, your liver is on the right. So pain can be from so many things. And then that left side has so many organs there. The stomach,
the spleen,
the ribs themselves, the skin, so many things that can actually be having any issue. Our advice is that it's best to see the doctor who can see you, take a better history, examine you, and know what may be causing the pain. So I advise you to see the closest hospital, and I'm sure they will take care.
Because it could also be related to the side effects of whatever
medication, so
he's
that
also
it could be.
taking. Yes.